Hi, today I will present to you the results of the cost effectiveness of an app-based treatment for urinary incontinence. My name is Loohuis. I'm a GP trainee and a PhD candidate from Groningen, the Netherlands. I have nothing to disclose. We conducted this study because women with urinary incontinence often experience barriers to seek help, and if they do, they often receive suboptimal care. An app could improve care and reduce costs, and many more had this idea as there are already over 100 apps available for urinary incontinence. There was little research done and none of them had ever been compared to care as usual. Previously, we showed comparable effectiveness after 4 months. This study shows comparable effectiveness and cost effectiveness of the app after 12 months. So how did we study this? Our design was a pragmatic randomized controlled trial conducted in Dutch primary care, and we included women with stress, urgency or mixed type incontinence who suffered from this 2 or more episodes per week. They were randomized to standalone app-based treatment or to their own GP, and after 12 months we assessed effectiveness based on severity of incontinence and impact on quality of life. Cost effectiveness was assessed from a 1-year societal perspective, and we used the eHealth and the quali. The quali is often used and based on a general measure of quality of life. The eHealth was derived from the incontinence-specific quality of life. I will further explain these measures later on. The results. 261 women participated in this trial, and after 12 months follow-up was complete for 89 women using the app and 83 women receiving care as usual. Effects showed improvement of severity and impact of incontinence in both groups, and there was no significant difference between the groups. Analysis of costs showed that the app-based treatment was cheaper than care as usual in both the total expenses and the UI-specific expenses. This would save approximately €160 per patient per year. We express the cost effectiveness in the incremental cost effectiveness ratio. First, I will explain this. It starts with the eHealth and the quali. These measures show health gain that can be used to compare effects and utility of treatments. The incremental cost effectiveness and cost utility ratio express the cost for a 1-point change in effect or utility after a year, if you would choose the new treatment over the old one. To keep it simple, what do we pay to gain health if we use the app instead of care as usual? Now we get back to the results. When we take a look at the table, we can see very small differences in effect and utility. For the quali, we know this difference is not clinically relevant, and this result is in line with the comparable effectiveness of the study. These small positive or negative results in health gain have a large influence on the ratio, and therefore it's more informing to take a look at the cost effectiveness planes. Since effect and utility are comparable, the most interesting area of the plane is where the app is cheaper. This is pointed out by the highlighted boxes. These planes show that 60% of 1000 bootstrap simulations confirm that the app is cheaper. The sensitivity and the subgroup analysis show similar results. In conclusion, app-based treatment for urinary incontinence shows clinically relevant improvements. The effect of the app are comparable to usual care, and the app is more cost-effective after 12 months. To keep it simple, an app is as good and cheaper than care as usual. The next step is implementation for the general Dutch population with ongoing evaluation. Thank you for your attention, and please ask your questions or leave your comments in the box below. I would like to thank the ICS for the opportunity to present and for receiving the Best in Category prize for the abstract.